The Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuiab, says it is exciting to know that the needle for immunization coverage in Nigeria has begun to move in the right direction, and positive changes are being recorded in the area of primary health care. Hence, the improved protection of children from disease and death, bringing about a better chance for a healthier childhood.
Our journey to a rebranded, transparent, highly professional and effective Nphcd'a has been characterized by many successes as well as challenges. It is exciting to know that the needle for immunization coverage has begun to move in the right direction, and positive changes are being recorded in the area of primary health care. The implication is that more children are being protected from disease and death and have a better chance for a healthier childhood. Households are also being protected from unnecessary health expenditure and are able to live more productive lives. We are grateful to God for giving us the vision and the passion to pursue our agenda of defeating polio, improving routine immunization, improving primary health care situation, and also restoring accountability to the agency.
Shuiab was speaking at the 2018 Service and Productivity Awards and sent forth ceremony of the Primary Healthcare Development Agency, Nphcd'a, on Wednesday in Abuja, emphasized that the most valuable success that has been made is in the creative and resilient people that work in the agency.
However, the most valuable success that I believe we have made in this year is in the people that work in the agency. Our idea of a rebranded Nphcd'a is one that has competent, hardworking, transparent, creative, effective, and dynamic civil servants. This event, which is the second in the series, during which performance awards will be given, is a testament of the fact that such brilliant personnel, future leaders in their own rights, have emerged in the agency. The awards they will receive are not products of just their individual efforts, but a reflection of the enormous work put in by their colleagues who have worked with them in teams, their directors, and other senior colleagues that have mentored them. Those people that we're especially recognizing are the folks who go beyond the call of duty to actually carry the rest of us on their shoulders, right? We also congratulate our friends that are retiring to another phase of their service and lives. We are grateful that you have provided sacrificial service to the country and have left indelible marks in the lives of citizens. You can be proud of your achievements and also know that you are welcome to the agency at any time, having performed meritoriously during your years of service.
Development partners, which include WHO, UNICEF, among others, were present at the ceremony and also gave their remarks.
Nigeria, the primary healthcare system, is a critical sort of pillar to what we do for our communities, and the first point of access for women and children. And there's been tremendous work. There's been a big push and momentum towards making sure that we are able to get the policy of the government of one ward, one PHC, the whole primary healthcare under one roof, actually operational on the ground. And we can see that the shifts are happening. However, However, there's still a lot of challenges. We need to make sure that every single primary health care center that's there in the country is functional, is able to offer the full set of services for women and children, and that people can reach those services and get the quality services they need. From UNICEF, we've been working so closely with the Nphcda'S, and in particular for 2018, I would say, since we're talking about this year, it's been an amazing year. We've done many things together. I think it's the motivation, the energy, the kind of focus and determination in many ways to get things done has been very, I would say, hugely appreciated by us. We have seen that there's kind of action. So you kind of agree for something, and then sometimes there are delays. But in 2018, we've seen very little of that. We've seen the action. We've seen us progressing quickly on agreed activities, in the job being done, and that kind of drive to make that difference. So it's been really good.
Okay. ED also took time out to shed more light on plans going forward in 2019 about the agency.
Forward to remaining focused on what our mandates are for the year. We're focused on those things that mean the most to all Nigerians. Questions around how will they be able to get basic health care when they are sick, that they do not have to travel long distances to access quality health care. What is going to be very prominent in 2019 is the implementation of President Buhari's Basic Healthcare Provision Fund. So with the Basic Healthcare Provision Fund, some 51 billion naira has already been released. Much more will be released in 2019 towards providing basic healthcare for all Nigerians in a way that ensures that people do not have to pay out of pocket for basic healthcare services. There's an insurance component and there's a component for primary healthcare, so that if you are sick, you're not worried that when you pay out of pocket that you become poor. Those are the things that are exciting us about 2019.
The Executive Director, Dr. Faisal Shuiab, took time out to honor some departed souls who were members of staff of the agency in the year 2018.
These colleagues died either through accidents, some natural causes, while some of them died in the quest of their duty to the motherland. So I please endeavor all of us to stand up and give a 1 minute silence in honor of the demise colleagues.